again at the end of staff updates. A recording of this webinar is also going to be provided in our monthly newsletter, and they are always available on our website. Okay, and now we're going to officially start the feature presentation. This month's speaker, Rebecca Ray, is the Director of Corporate Public Relations at Allsup, a nationwide provider of Social Security disability insurance representation, veterans disability appeal, return to work, exchange plan, and Medicare plan selection services. Her current responsibilities include community and media relations, public policy, and corporate communications, both internal and external. Her background includes experience in health and workplace wellness and the boards of disability organizations, as well as community-based centers for independent living. She regularly interacts with people who have disabilities and disability-related organizations across the country, answering questions and providing resources and materials to individuals and community groups. Rebecca, thank you so much for joining us this afternoon, and we are truly appreciative of the time and energy that you have put into this afternoon's presentation.
Thank you. I'm glad to be here. I'm glad to be a part of the presentation and bring some of this information to your audience. We're really excited to be a part of your pep talk. I guess we can move on into the presentation. I'm going to be talking about navigating employment challenges and when to apply for Social Security disability. You can move to the next slide. Today we're going to cover employment, working with chronic pain, then taking a very close look at Social Security disability insurance as a lifeline for workers, understanding how chronic pain relates to the SSDI program, and then a run through of the key advantages of using Social Security disability insurance. It's a program that's not very well understood until people dig into it, really need to access it. So if you're in the preliminary stages of learning about it and understanding it, this presentation hopefully will provide you with a lot of good information. Next slide. We have been helping since 1984, more than 35 years. Allsup has been helping people with disabilities to apply for and receive their SSDI benefits, and as a result, they also receive Medicare benefits. Our services include representation, return to work, help for individuals with disabilities, and then veterans disability appeals and healthcare insurance assistance. All of that wraps into kind of our comprehensive view of an individual experiencing an acquired disability and having to leave the workplace and go through this process of accessing the federal benefits that they've been paying for through their FICA taxes. So that's kind of the quick overview of what we do in this realm. Next slide. So I'm going to talk more a little bit about chronic pain itself and how it affects work. Next slide. So here's some data and information that helps put a little bit of context around this topic. About 36 million Americans miss work in a single year due to pain. And the ages 45 to 64 are most likely to report pain that lasts 24 hours or longer. The average age of a disability for Social Security disability benefits is 54. So you can kind of see that it's right in that middle window of that age group of experiencing disability and severe pain. Workers lose an average of 4.6 hours of productive time per week due to pain, and then lost productivity costs a significant amount in terms of the U.S. Economy. Next slide. So in terms of dealing with chronic pain, individuals often will take a leave. These are some data results that we pulled from another study, but 70% of workers will change jobs to try to find something that's less strenuous and can help accommodate their pain that they might be experiencing. 13% will get help with activities of daily living. 13% may move to a home that's easier to manage. Some of the common types of chronic pain include low back pain, severe headaches, migraines, neck pain, facial pain. Pain comes in a lot of varieties and forms, and it's something that most, if not all, of our customers will deal with in some shape or form with their condition, their disability that they're seeking SSDI for. Next slide. So what's involved with trying to make sense of, do I keep working? How do I deal with this pain? What do I do when it comes to maybe seeking benefits through Social Security disability? Generally, what we've found is it's very individualized. It's really the individual's decision and choices about what they need and how they're going to continue. It's understanding the impact of that pain on their daily living, what they're able to do in the morning midday, afternoon, evening, how does it affect their day? The effectiveness of the treatment that they've found for managing those symptoms, if they're struggling to find a treatment that's working, or if they need to talk to specialists and things are kind of taking a turn where they're having to miss more and more work, that's something to think about. The ability to continue to either work part-time or full-time, and then possibly working with your current employer for modifications. Just understanding that you have rights under the ADA to try to maintain employment as you experience, the impact from chronic pain. So all these things come with decisions and choices about what you do, and that includes your options for income, health insurance, housing, and that kind of thing. Next slide. So that's where we highlight some of those options when you stop work. Individuals often will consider short-term disability insurance or long-term disability insurance if they've been paying for that through their employer. Workers' compensation benefits may be an issue if it's related to work-related injury. Social Security disability, which we're going to talk more about. Sometimes people turn to family or friends, and then they may go through a financial reorganization, changing their budget, looking at what they have in savings, maybe changing their living arrangements, just other things if they do have to quit working just because of the lost income and the situation that might put them in. Next slide. So then we come to Social Security disability insurance. Next slide. It's really a lifeline for former workers. It was established in 1956. It's paid for by workers and their employers. Both pay a portion of these taxes through FICA taxes. Essentially, it's insurance coverage that you're paying for. You're covered if you are working and paying this tax. You must be both currently and fully insured. What that means is just you must have been working recently. So if you've been out of work for several years, you may not be currently insured or fully insured. So Social Security looks at these stipulations before they start to look at your claim to see if you actually are insured and have been paying for the coverage. If you're under age 31 and become disabled, it is possible to have less than 20 quarters of coverage to be fully and currently insured. So that's something to keep in mind, that age may be an issue. And SSDI is not means-based. It's not based on whether you're low income or not. It's based on if you've been working and paying for these, paying these taxes and are insured. Next slide. So how is it a lifeline? Essentially, it combines disability income and then free return to work assistance. Really has a dual purpose for people who are experiencing a work crisis, if you will, due to disability or medical impairment. It's possible that some kind of issue may take you out of the workforce for, 2, 3, 4 years. But then on the other side of that issue, if you are able to reach some stability and recovery, you could return to work. And so there's additional assistance through SSDI. It's a very important thing to realize about this program. It doesn't mean that you're permanently forever not going to be able to work. In fact, there are a lot of advantages to using this program to then return to work at a later time. Has some incredible value, including preserving your Social Security benefits. One of the benefits of seeking SSDI and getting that coverage is that you protect your retirement income. All those years that you may quit working because of an impairment are not going to count as zero if you get your SSDI benefits. If you don't apply for SSDI and quit working and then wait till your retirement age to get Social Security, there are all these zeros and you're showing for your income because you weren't earning and they didn't know that you had a disability because there was no claim filed. So there's another protection for your retirement to keep in mind. Only 1 in 3 private sector workers has employer-provided disability. So SSDI really is the lifeline for most American workers. 155 million American workers are insured for this benefit. So it's really important to be aware that this is out there for them. Most people know about Social Security retirement, just don't think about the disability program. Many beneficiaries also have multiple disabling conditions, about 62%. So it's going to be a combination of issues that might be affecting someone's ability to work. Next slide. So then we have a comparison here of the SSI program and SSDI. Many people may be more familiar with disability benefits when it refers to people who are very low income and don't have a work history. It's known as supplemental security income. It is means-based. It is essentially what someone might call welfare program, but based on having very low assets. The SSDI program, on the other hand, is for more workers. So it's not based on any kind of income level. It's just whether someone's been working and paying for this coverage through their FICA taxes. Here you can see a comparison of the benefit amount there. For the average former worker, about $1,200 a month in benefits is is what we find. And then the maximum benefit amount can be significant, and people also can, if they have dependents, children age 18 and under, have additional benefits. So it can end up being a very valuable source of income if they have to quit working. Next slide. So who's eligible for SSDI? The SSA defines a person as disabled if they have a physical or mental impairment that prevents them from substantial gainful work. They have a dollar amount that they put toward this, and they look at your ability to work. Generally, your condition needs to be lasting 12 months or longer, or be a terminal condition. So it needs to have the severity that's going to be truly severe and long-term. That's something to keep in mind. The condition and your medical records and your doctor all indicate that you're going to be out of work for 12 months or longer, or you've already been out of work for 12 months. It's a good sign that, hey, you are probably going to need this benefit and should consider applying for the benefit. If you meet those disability definitions for Social Security and you've worked 5 out of the last 10 years, it's also important that you've not reached retirement age. If you have reached retirement age, then essentially you're eligible for the retirement benefit. And then also it's very important to have medical proof of your disability. And we'll get into more of that in a few slides. Next slide. Defining disabled, here's a little bit more information about what Social Security looks at. Generally, they look at that you cannot do the work that you did previously. They try to determine whether you can adjust to other kinds of work. And then again, they look at that time frame or that window of how long this disability is expected to last. You can kind of see the categories of types of disability that tend to receive SSDI. These are the numbers of former workers. You'll see the larger categories, musculoskeletal and connective tissue, including back pain is a large category. Mental disorders also is a larger category. Kind of see the fluctuations over the years of how some things have changed and shifted. Next slide. This is an overview of the Social Security disability process. Consists of 5 levels. Can kind of see it goes around in a circle. As it gets redder, the color indicates that it's getting tougher to receive benefits. The Social Security Disability Program is a tough program to receive benefits through. There is an initial application level. 33% of people are awarded at this level. It's pretty small, between 33 and 35% at this level, and then you can appeal to the next level, which is known as reconsideration. You can appeal again if you're denied to the hearing level. Most people, when they hear about disability applications, are probably more familiar with hearing about the hearing level or going to a disability hearing or waiting for disability hearing. The approval level at the hearing level, which is that 3rd level, is 45%. And then if you're denied at that level and appeal to the last higher levels, appeals council and district court, it drops significantly to just 1 to 3% of people being awarded benefits. Overall, it can take someone quite a long time to get through this process, which is why individuals might work with someone like our organization, Allsup, and get help with their representation. Essentially, they're trying to get assistance, and we are working to try to help them receive their benefits at the very initial application with the beginning of the process. If they are awarded at that level, it's only 3 to 6 months, and then they've gotten their benefits, and that's what we aim for. We have more than 50% of our customers who get their benefits at the initial application, which means that they don't have to proceed then through all of these appeals. So there's a significant benefit to that. Next slide. Okay, chronic pain and applying for SSDI. We're going to talk more about chronic pain specifically as it relates to this program. Next slide. So how is disability determined? These are the steps required for anybody with any type of condition, whether it involves chronic pain or not. But typically they look at, are you working, and how much you might be earning per month. If you're earning less than $1,220 per month, then they consider that less than substantial gainful activity, and consider that you do pass that criteria. They move to the next criteria is the severity of your impairment, looking at medical information they may have, how long you've been out of work, what kind of condition is it. They have multiple medical listings, and I'll get to that in another couple of slides. But they look at that severity, and if they determine, yes, it does look like it's interfering with work, they move on through the next step. Does your condition meet or equal a medical listing? Social Security maintains extensive listings of conditions and diseases to try to determine and make it more I guess, as simple as they can to determine if a condition will, qualify under Social Security disability, and they can clearly understand that, oh yes, this condition qualifies, you're eligible. They move you then through the next step of their evaluation process, which is, can you do any of your past relevant work? This is looking at your past work history, which is where it's important to understand the jobs you've done in the past, what kind of education level you had, other experiences, how that relates to where you're at now when you're applying for SSDI. If you make it through that evaluation step, they then look at, can you do any other kind of work? And that's where they look at age, education, work experience, other factors to try to determine your ability to either find some other kind of job with the condition that you're dealing with, or inability, and clearly understanding or coming to the decision that yes, you're disabled and that you'll be able and approved for these benefits. Next slide. This is an overview of the SSA's impairment listings. They have 14 medical listings altogether, and several specifically mention pain. There is not a listing just for pain. So pain falls under these conditions, if you will, considered a feature or characteristic of types of disorders and conditions and health issues. So here you have several listed. You can see musculoskeletal, a little bit of phrasing there that shows that it's the intensity and persistence of pain. They're looking at the involvement of pain in these conditions. Respiratory, cardiovascular, digestive, genitourinary, hematological, neurological, mental disorders, cancer, and immune system disorders. So all of those are conditions that can incorporate some level of pain or have pain specifically mentioned. Next slide. Pain assessments. We're starting to get into the value of the medical treatment, working with your physicians, having specialists to help document how your pain is affecting your activities of daily living, your ability to work, and your daily life experience overall. These are some examples of assessments and scales and tools that are used to document the amount of pain or the type of pain someone's experiencing. Tests, medical records, documentation, doctor's notes, and any of that kind of information is going to be incredibly valuable for your claim for disability benefits. So all of these are important to be aware of, and especially when working with a doctor to try to document your chronic pain. Next slide. These are some recent developments, just to let you know that this area is always evolving and changing. There is some research underway right now by the National Institutes of Health to develop more objective ways to measure pain. Studies are happening now. There are a variety of them. Some of them are looking at how can we address and identify pain markers through brain, like brain scans, through our pupils, like in the eyes, or using tools that can measure pain through scans of the eyes. Essentially, the National Institutes of Health is working to create a painometer, if you will, or some type of objective tool that would help to measure pain and evidence of pain, because it can be a subjective experience for many people. It's important to be able to continue to further develop these tools and ways to document them, especially for programs like Social Security Disability Program. Another recent development is Social Security has posted a notice of proposed rulemaking. It just closed February 15th to look at the consideration of pain in the disability determination process. They were looking for feedback on how is pain evaluated, how is it considered, how do they look at it, what kind of documentation should be valid, what kind of tools should they look at and refer to. And they're examining different pain types and the influence of it, and how it might factor into the decisions they make when they look at claims, including types, acute pain, chronic pain, or neuropathic or nociceptive pain. Those two last terms may be unfamiliar to some of you. Neuropathic refers to kind of internal causes or nerve-related pain, whereas nociceptive pain refers to damage to the body or external causes of pain. So it's definitely a changing environment for understanding pain and how chronic pain affects individuals, and as it relates to Social Security disability as well. Next slide. So the key here is to be able to document with your Social Security disability claim, and that's where working with your doctors and having specialists and that kind of support is going to be absolutely critical. With this first quote at the top here was from the notice of proposed rulemaking. It was a response from a representative to Social Security, just clarifying that often they look for evidence of another medical condition, and then they look at the pain. So they're looking for often some other type of impairment. So they can say, oh, well, the impairment is, for example, arthritis, and then here is the evidence of the pain and the effects of the pain. So that's one of the things to keep in mind, is that you may be challenged if you're going to Social Security and say, I'm filing a claim for benefits because I have chronic pain, without having some other underlying condition or cause or impairment that's paired with that pain, such as, for example, arthritis or back injury or something like that. So it is complicated, and it does require a lot of medical evidence. Social Security is looking for documentation. They're looking for the severity of the effects. As I mentioned, activities of daily living, there's a lot of documentation with that. That's one of those things where working with a representative like us, we can help with documenting that, kind of tracking all of the effects that the pain may be having on how you live your day-to-day life. Medications that are used, and then the presence of other diseases or conditions. And then there are a lot of specific questionnaires and assessments. So, I mentioned some of those earlier. There are more than 24 types of assessment tools that are available to medical providers, and sometimes it can be helpful to pay attention to what those are and what your doctors are using to document chronic pain. Next slide. So this is a look at why people need help with representation through the process. Most workers are unaware of SSDI benefit, usually not really thinking about it until they become desperate. They've had to quit work, they have no income, and they're really looking for assistance. About 2 million people apply for SSDI each year. It can be complex. As I mentioned, it has 5 levels there with all the appeals included. A lot of people are denied for technical reasons, just not having certain information completed. So that's where a representative can assist as well. Many individuals wait until the hearing level to hire a representative. For example, only 18% will have a rep when they apply, but by the time they get to the hearing, about 78% of people have found a representative. So it can be to your benefit to start early with someone helping and advocating for your claim. And then, as I mentioned earlier, it can take a lot of time, so sometimes it's important to think about your financial options as you go through this process. Next slide. This is a quick overview of the disability hearing backlog, just a sense for the wait times that it can take some people when they are appealing. The hearing level can require an average of 18 months right now to get through. And then it can take up to 5 months for the hearing decision to be written and completed and the payment to be processed. So as you can see, just almost 2 years just for that hearing process alone. In addition, you have your initial application and first appeal. So altogether, it may take someone 3 years to get through this process. So just keeping that in mind when you get started and think about applying for SSDI. Next slide. This slide is just pointing to the benefits of getting help. The Office of Inspector General with Social Security issued a report a few years ago just saying that individuals who had representatives earlier were able to avoid several hundred days in their claim process because they had assistance and were approved earlier. So it's another benefit of having someone to help with the claim. Next slide. This is information on representative fees for representatives that you might hire to assist you. Generally, they're contingency based. There's only a fee if someone is awarded benefits, and then that fee is regulated by Social Security Administration. So it's 25% of the retroactive payment, and the cap is $6,000. It's often lower than that. Individuals who are thinking about getting help with their SSDI claim can ask about additional charges and medical records and other things like that. But typically there's a standard rate, and there's a cap, and Social Security oversees those fees and rates. Next slide. This is a little information about our online tool. Social Security has an online application form. Allsup also has developed our own online application form, really designed to be as user-friendly as possible to help with completing all the information and understanding what Social Security is looking for specifically when someone applies for SSDI. We found that a lot of people appreciate the convenience of having that assistance to get through the forms really quickly, and makes it a lot easier, not having to guess what Social Security is really looking for or what they want in terms of the information. That's something that we've already done in terms of creating our tool. And then additionally, just reminding people about the value of representation. And it also removes the guesswork, and it's designed with helping people to get through as quickly as possible and get their benefits approved. Next slide. Just a little bit of information about the comparison of awards how many people are awarded. The national average at the initial application, they have a 35% award rate. As I mentioned, Allsup is more than 50%. Your reconsideration level, it's much tougher at that level. It drops significantly. And then by the time you get to the hearing, you have a slightly higher chance of being awarded benefits. So all those steps are quite difficult. It has gotten more difficult in the past few years. Mainly Social Security has introduced a lot of regulatory changes that have made it tougher. Just fewer people are receiving benefits, and it's a more stringent program than say 5 or 6 years ago. Next slide. Another important value that we like to highlight is just healthcare insurance and needing healthcare assistance. We offer this as part of our representation service. We found that 1 in 3 of our customers would lose their health insurance while they were waiting up to 3 years for those benefits. The challenge there is that if you don't have your health insurance, you may be challenged then to get to the doctor, get the medical treatments you need, get the medical tests that you need because you don't have insurance to help cover the cost of those things. That can be difficult for your claim because then you may be lacking in current medical evidence, medical records, and the things that Social Security needs to evaluate your claim for disability benefits. So we started offering this assistance with healthcare insurance, choosing plans, helping with marketplace enrollment, and then Medicare, which is available after you receive SSDI benefits. Next slide. So the benefits of SSDI, these are really important to keep in mind, and I'll quickly go through some of them. So you understand why you want to apply and seek this support. Monthly income, as I mentioned, that's really the key reason most people apply. They may not realize that they also get Medicare benefits. That's health insurance that you're covered with 24 months after your SSDI cash benefits begin. You also get a COBRA extension. If you're receiving COBRA and you're having to wait for that Medicare to start, you can get an extension of your COBRA coverage. Next slide. The protected retirement benefits, I mentioned this earlier, that you get a freeze on your records so that those years when you aren't working won't be computed in your retirement benefits. So that's another important benefit of seeking this. It also often protects your LTD or long-term disability coverage. Those policies usually are designed to coordinate with Social Security disability, so they're designed to work together, and often your policy will ask you to apply for SSDI if they determine you do have a severe long-term disability. There's additionally dependent SSDI coverage, as I mentioned earlier, and then return to work incentives. Next slide. Do you want to spend a little bit of time talking about that return to work program because it is free. It's available to anybody who's getting SSDI and is motivated and wants to try working again. You can start that up at any time after you've been getting benefits. It could be 3 years later, 10 years later, 15 years later. You think, well, I'm really stable now. I want to try to work for a little while. There are some important benefits for that, including financial. You can really help your retirement situation. And then you have several years of protection where your SSDI is protected. You can try to work. If you decide that it's just not working out, you can go immediately back onto your SSDI benefits after testing that out for a while. So just some important benefits to keep in mind. In addition, you can get free assistance from employment networks. Next slide. Again, just reviewing some of the benefits of that Ticket to Work program. Knowing that you might be able to go back to work can be really helpful and valuable as you're making it through this SSDI program. Some people start applying for SSDI and just become, concerned about their ability to work again. Sometimes they give up or just give up on that idea because it can take a long time to apply for SSDI. We try to encourage people to just not give up on their options or realize that there are all these supports and incentives there for you. You do not have to use them, but just remember them if you feel like you do want to try. Can be incredibly valuable, and Ticket to Work essentially is a free program. Next slide. These are just a few resources for information. You can find information about the assessment. You can understand a little bit more about SSDI itself. Social Security also has a lot of information about the disability process, how those determinations are made, kind of the step-by-step through the application, filing your appeals, going to the hearing, that kind of thing. There's a lot of information online. It can be a little bit confusing, but anything we can do to help, we try to as well with our website and then through our online assessment. There's also information on the Return to Work program online. Also the Job Accommodation Network, askjan.org has information. If you're trying to work with chronic pain right now, and looking for some maybe accommodations or ideas on how to talk to your employer. Maybe you're not ready to quite right now to quit working. You want to see if you can manage a flexible work schedule or find some other ways to continue working for a while. That's a good website for resources there as well. Next slide. And now we're to our contacts and information. This is just information in terms of if you're wanting to learn more about working with Allsup and getting started with our website. We have our website at truehelp.com, has information. You can get started with us. And if you're already receiving Social Security disability benefits, or if you're interested in understanding what it would be like to go back to work, we do have a phone number information there and a website for allsupemploymentservices.com. Really trying to do more to help people understand the dual purpose of Social Security disability insurance, not just about getting that income and Medicare health insurance coverage, but also remembering the ability to return to work for a little while if they can. So that's a really quick run through of the SSDI program, chronic pain, and how it relates to applying for SSDI, and appreciate the ability and opportunity to talk with everyone, and then we have some time for questions, I think, here at the end.
Excellent. Thank you so much, Rebecca. That was an incredible snapshot of the programs that are available for individuals who may qualify for this program. We have been monitoring and been receiving questions during your presentation, and we will open it up to questions now. If you guys want to type in your questions over using your control panel and clicking on the question mark button there. Somebody wanted to know if it would be better to apply for SSDI or to get an income under their husband's Social Security. And he, just for context, the husband's 65 and he does receive Social Security, she's 62. Are those questions that organizations like yours can help with?
Yeah, definitely. It can be a difficult decision on that. Clearly, you could go for, I mean, if you're 62, you could file for early retirement, and you can look at coordinating under your husband's benefits. And there are, of course, specialists out there to look at Social Security benefits, financial planners and advisors. What we do find and have indicated over the years is that there's some significant benefits to applying for SSDI under your own work record. If you're 62, keep in mind if you take early retirement or if you're filing for benefits under a spouse, your benefits may be a different amount than if you're using your own work record. If you do apply for SSDI and you are approved, you receive essentially what's your full Social Security retirement benefit amount. So it'd be the amount that you would be receiving when you reach full retirement age. So as you make it through those years of early 60s into your full retirement age, your benefit converts to Social Security retirement, and then you're receiving your full benefit amount. So there could be a significant difference in the benefit amount, and it's something too where you can check with if you have your Social Security or My Social Security account, you can go on there and you can kind of determine. They give you the amounts that you, based on your earnings, they give you the amounts that you would receive in a benefit if you were approved for Social Security disability versus early retirement versus your full retirement age. That might help you decide that as well.
Okay, great. Someone wanted to know if you could provide any information regarding workers' compensation and SSDI. Can you receive both? Does one outweigh the other? How does that work?
Generally, well, there's a lot of specifics based on where you live, the state you live in. There are a lot of different rules, so it can be complicated. You can receive both. Sometimes they do coordinate, and sometimes there is an offset. So if you're receiving SSDI and you receive workers' comp, there may be an offset where one or the other kind of balances against the amount of money that you're receiving. So it is a little more technical, but it could be a significant benefit to look at applying for SSDI in addition to using your workers' compensation benefit. We do not specialize in workers' comp, but we do we do assist with coordinating those benefits when someone is eligible for both. But it is something, again, that you may want to talk with someone who specializes in workers' comp, or if you are working with someone to reach a settlement of some sort, maybe talking with them about that as you put together your financial planning.
Okay, excellent. Thank you. And another attendee said that they have been on SSDI for several years, and if they begin to earn minimal income, so not able to work consistently, do they have to report it to SSDI? And does the return to work program trigger a review?
Those are all good questions. That is one of the main benefits of the Ticket to Work program. It is protecting you from any kind of review, and they pretty much clear your claim of any kind of review if they understand that you're trying to work through a Ticket to Work program. In terms of reporting your earnings, it is advisable to report your earnings to Social Security. Generally, the employer is reporting at the same time that you might need to be reporting. So at some point, they're probably going to learn about the earnings that you might be having through the employer, whether it's whether or not you're reporting to them. That is one of the benefits of working with Allsup Employment Services is we handle all of that nitty gritty of all of that reporting, wages, earnings, coordinating, making sure that the benefits are protected, that you're not going to get your claim reviewed or continue, that you're protected from the continuing disability review. It's one of the best benefits and perks of the free assistance from Allsup Employment Services. It just really makes sure to protect your benefits if you are doing some work and have some work and are attempting to see how that goes. Generally, Social Security and the Ticket to Work program is designed to encourage full-time work, but our organization is really lobbying and working hard in Washington to also appreciate the value of part-time work and just the benefits for individuals to be able to have some amount of work to assist them as they get closer to retirement as well.
Perfect, thank you. On one of your earlier slides, you were talking about qualifications, and one of the things that you had noted was substantial gainful activity of $1,220 per month, and then in parentheses you put non-blind. Can you expand on what you mean? Is there a separate program for individuals who are blind?
There is some different stipulations for individuals who are blind. And when it comes to substantial gainful activity, it's a significantly higher dollar amount. So for the individuals who are not blind, that substantial gainful activity amount is $1,220. For individuals who are blind, that dollar amount is $2,040. So individuals who are working and earning less than $2,040 are considered then are not at that SGA level. So that's what that means. There are some provisions around non-blind versus blind. So yeah, it's good that whoever that was, caught that. So yeah, there is a distinction, slight distinction.
And if someone has, not for themselves, but if they have a child, let's say, who is blind, would you advise a parent start an application process before they're 18 because they were under the impression that you do have that ability to apply a few months before the age of 18?
It sounds like the individual is talking more about the SSI Supplemental Security Program, unless they're talking about the individual applying on their own SSDI record. It does start to get pretty complicated with those kinds of questions. Mm-hmm. It could be something where you could contact Social Security directly and ask them for some guidance on that. Often when we work with our customers in general, we tell people to go ahead and get started with the program that they're interested in and determine what they might be able to access and when. Generally, Social Security, I don't know if you're aware, they've closed a lot of field offices. They've reduced their staff a lot. There's just a lot of processing backlogs at all levels of Social Security's program that it might be a good idea not to delay, when you are looking at starting with a benefit or looking at getting started with some kind of Social Security interaction, paperwork or filing or application, that kind of thing. I hope that's helpful.
Yes, thank you. A lot of people are interested in the Ticket to Work program, and so we're getting a few questions here. If you wouldn't mind just taking a few moments talking specifically about that. One individual in particular had wanted to know, is there a limit to the how often or hours wise can you work under Ticket to Work program, and what are you allowed to legally earn if you go back to work?
Yeah, those are all good questions. So to begin with, I guess you could look at Ticket to Work as kind of a phased program. There's kind of the first phase, a second phase, and the third phase, if you will. First phase is called the trial work period. And essentially you have 9 months over a 60-month period. It's a really long period where they allow you to try to work. and that includes, that comes with a 3-month grace period. And you can work and earn as much money as you can. There's no limit to how much you can earn, and you continue to receive your Social Security disability benefits. Essentially, what you're doing is testing your ability to work and earn a certain amount of money, and see how that goes, and if you feel like you can move to full-time work over the long term. After that 1-year trial work period, you have an additional 3-year period of being able to work and try working. And they give you a certain dollar amount they kind of measure whether you're, it's based on dollar amount, not hours of working per se. They look at that dollar amount to see if you're earning over that amount or under that amount, and whether that amount, that month counts towards your earnings. As you continue to try that, if you have any months where your earnings are below that dollar amount, you can still receive your SSDI benefits for that month. Just the assumption is that you weren't able to maintain work, and your SSDI is still there and it's protected benefit. After that time period, then as they assume that you're moving more and more into full-time work and able to leave the SSDI program, you have this extended period of eligibility. It's a 5 years of protection where you can, if you are working, but then it's just not working out, you have to quit, you can restart your SSDI benefits, and it's essentially like a 5-year window or a period of protection for your SSDI benefits, and they can restart, and if you've determined that you can't work. So overall, it extends out to several years of protection of attempting to work, trying to work, seeing what your earnings are, and evaluating whether you want to go back to working full-time if you can manage that. And if not, then you work with an organization like Allsup Employment Services. We kind of handle all of the regulatory nuts and bolts of that, helping you to understand, okay, here's where you're at now. What do you want to try to do? Do you feel like you want to, you can't continue to work full time? Or does it feel like it's just not something you can manage, and you want to return to your SSDI benefits? So it is very much an evaluation process all along the way. And for our service providers, we really understand that it can be challenging because often people who've been out of the workforce for a few years have a lot of things to kind of get their minds around. And, they may be really motivated, but there may be some challenges and struggles with this process of learning and experiencing what it's like to get back into the workforce again, which is why it's very helpful to have those, 60 months and then 36 months and then additional 5 years of protection all around that process.
And so then just so we're understanding correctly, can you use Ticket to Work if you're on SSI or Adult Disabled Child Benefit, or is it one or the other?
You can use Ticket to Work if you are receiving SSI and SSDI. If that's
Okay.
for anybody getting Social Security, Social Security disability, it is designed for that. The rules are a little bit different. The rules that I was describing are for SSDI, for former workers, because there's an understanding with former workers that they have a work history. So the program's structured a little bit different than for, say, for SSI. So that's where it gets into a lot of complications and a lot more information around the program, but good to be aware of as well.
Absolutely. And what would you say to somebody who might have some reservations for participating in the Ticket to Work program because they're concerned that, if something should happen where it's too difficult for them to work, will they lose their benefits? I mean, these are some anxieties that I think our population has, is that if they try to enter into the workforce again and then during that grace period or even following during the 6-month period, they find that they can't. Is it difficult to go back and receive your benefits in your experience?
No, there are specific provisions in Ticket to Work, which is why we highly recommend working with an organization like Allsup Employment Services. We're an employment network. Social Security has approved us to provide these services. What we often find is where people make a mistake is they try to do it on their own, and they don't know about Ticket to Work. So they start working, and they start trying to work with Social Security's office and say, hey, I'm doing this and this, and they just don't realize there are all these other protections, and there's someone who can help them coordinate it all. Do you know what I mean? And so then they miss out on all the free assistance they could have in trying to work. And then, as I mentioned, there's a benefit called the expedited reinstatement. benefits. If you can't work and you've been getting SSDI and you've tried it for a certain period of time, it's just not working out, they will immediately restart your benefits when you report to them that, hey, I'm just not able to work. So yeah, there are a lot of benefits to understanding Ticket to Work and getting a handle on all those options there. It's specifically designed to protect and help people to feel more secure about working and trying it out. And then yes, their SSDI is protected and it can be restarted, generally immediately. Within within a time period, letting them know that I'm not going to be working any longer.
And just to clarify, and this will be our last question, do you have to quit work in order to apply for SSDI, and how long do you have to be unemployed if that's the case?
So technically, you do not have to quit work to apply for SSDI. If you are earning under SGA, that amount that we listed earlier, Social Security should look at that and go, oh, you're under SGA, and so you're not gainfully employed, so you can apply. However, Social Security is very stringent, and if they see some evidence of a current, like you're currently working, there is a greater chance that they're going to be like, well, you're currently working, so we're not too sure why you're applying for SSDI if you're currently working. So generally, it's I guess for your better interest to quit working to apply for SSDI. Now, in terms of getting to that point where you do have to quit, there's no time frame around quitting work and how long you have to be without work and how long you must have stopped working to apply for SSDI. The time frame that's more important there is how long is your condition expected to last. So how severe is your impairment or illness? Is it 12 months or longer? Can you demonstrate that? Do you have medical evidence that indicates it's a severe condition that is going to last 12 months or longer? So that's kind of where the time frame is more important.
Okay, great. Well, thank you, Rebecca, for staying a few minutes later than we had expected. There were so many questions and we actually didn't get to all of them, but would you advise for individuals who may have had questions that weren't answered to either visit the website and or utilize that info@allsupes.com email?
Yeah, they can easily email the info@allsupes.com, especially for the Ticket to Work. If they're interested in SSDI specifically, they can go to truehelp.com or file ssdi.truehelp.com. And we have our phone number on there as well. They can call the Disability Resource Center to get some additional questions answered. I appreciate the opportunity. Thanks very much for allowing us to talk about this topic.
Thank you, Rebecca. I think it was very helpful for many of our attendees and for those who